Shock is defined as a lack of oxygen to the body's tissues. Shock is a life-threatening condition where the circulatory system fails to provide enough oxygenated blood to the body. Shock can be caused by severe internal or external bleeding, loss of bodily fluids like dehydration, diarrhea, vomiting or burns, severe allergic reactions, or infections like septic shock, and finally, spinal cord injury. There are different types of shock, and now we're going to look at a few of them. The first one we're going to look at is hypovolemic shock. This is a lack of content in your body's circulatory system, which causes the heart to work harder to try and pump blood around the body. One way hypovolemic shock happens is when the patient loses a lot of blood through internal or external bleeds. Neurogenic shock can result in complications such as sustained and severe hypertension, which is low blood pressure and often occurs with bradycardia, which is the slower heart rate. This low blood pressure may continue for an extended duration, lasting several weeks after the initial injury. A disruption in the autonomic or ANS nerve system pathways causes neurogenic shock. It can occur after damage to the central nervous system, such as spinal cord injury or traumatic brain injury. The ANS is part of the peripheral nervous system that controls involuntary bodily functions. These functions include regulating heart rate, blood pressure, respiration, digestion, and other essential processes that occur without conscious effort. The ANS is divided into two main branches: the sympathetic nervous system, which prepares the body for fight or flight responses, and the parasympathetic nervous system, which promotes rest and digest activities. Cardiogenic shock is a critical and life-threatening condition in which the heart is unable to pump sufficient blood to meet the body's needs. This leads to inadequate blood flow to the vital organs, resulting in severe complications. While it's most commonly triggered by a significant heart attack, not everyone who experiences a heart attack will develop cardiogenic shock. The condition occurs when damage to the heart is so extensive that it impairs the ability to function effectively, often requiring urgent medical intervention to prevent further deterioration and improve survival outcomes. Anaphylactic shock is a life-threatening, severe allergic reaction to substances such as food, insect bites, or medications. Signs and symptoms of shock include rapid and shallow breathing, a weak pulse, sweating, pale, clammy, cold skin, blue-grey coloured areas around the lips and the extremities because there's not enough oxygen-rich blood reaching these areas. Weakness and dizziness, feeling sick or vomiting occur as the brain's oxygen supply decreases. Other signs include restlessness, aggressive behaviour, thirst, yawning and sighing, and finally they may become unresponsive. If the casualty has one, they need to use their auto-injector. If not, treat them for shock. The treatment for shock is to call the EMS as soon as possible. Treat any obvious injuries to the patient. Lay the patient down and elevate their legs 15 to 30 centimeters to allow the blood in the legs to supply more to the vital organs, unless this will cause problems with other injuries. Keep them warm by covering them with a blanket or a coat and reassure them. Do not give them anything to eat or drink, as this would divert blood to the stomach rather than their vital organs. Keep monitoring the patient carefully, and if they stop breathing, start CPR. And finally, it's worth mentioning that fainting is a mild form of shock, treated by laying the patient down and elevating their legs. Patients often recover quickly from fainting, and it doesn't usually require calling the EMS.